My name's Dr. Catherine Bacus and I'm founder of Alivia Medical Weight Loss, and we're a specialist GP obesity service here in Melbourne. So I first wanted to start by acknowledging the traditional custodians of the land in which we meet, the Wurundjeri people, and pay our respects to our elders past, present and emerging. So it sounds like Claire and I have been talking because we're going to be talking about very similar things, and I think that primary care probably does provide that really nice segue into how we can provide that ongoing care for patients who live with overweight and obesity. So I think GPs are ideally placed because they are with patients throughout their lifespan. So we've got opportunities for intervention from, a woman who's pregnant and in those early gestational time, which we know is crucial for reducing the risk of obesity, education around nutrition in the first 4 years of life, intervening in key times in a person's life when obesity is a greater risk, when they're leaving home, the time of menopause, the time of retirement, stopping smoking, etc. So I think that whether it's screening patients for obesity, starting conversations with patients about the impact of obesity on their health and their day-to-day living, assessing their readiness for change and their readiness to seeking treatment, understanding what they have done in the past so that we can tailor our advice around what other treatments are available, and really discussing those treatment options in depth with a patient, whether that's going to be lifestyle change, certain dietary interventions that might be effective for them, physical activity, pharmacotherapy. We've got that ability to intervene, when the weight risk is starting to increase, and also provide advice and link patients in with other healthcare professionals, be that other allied healthcare professionals or bariatric surgeons if necessary, to help those patients who live with more severe obesity that's impacting on their overall health and well-being. And I think that GPs have got a little powerful tool up their sleeve, and that's the power of enduring relationships. And that's a significant benefit and I think advantage for GPs in managing overweight patients who live with overweight and obesity, because a good GP understands the complexity of the factors that contribute to an individual's weight story and works with them over time with incremental change to assist them to manage this chronic condition. So I just wanted to talk a little bit about what the barriers and solutions might be for managing this problem in general practice. So this is probably more a backward step from that sort of patient-GP interaction to what's going to enable GPs and primary care to deliver obesity care. The first one is funding, and providing obesity care is time intensive and is currently not funded adequately. We just have our time-based MBS item numbers, and this inevitably takes more time to understand what patients have done before, what are the treatment options, discuss those treatment options, discuss lifestyle change, and that all is very time intensive. In addition, PBS does not subsidise any anti-obesity treatment thus far, which means that accessing care for obesity is more costly to patients. So what can we do? Well, we either ask our patients to bear the cost, which I think is unacceptable, or we start providing more MBS rebates for obesity care in primary care. And I think that the NACOS group is currently looking at this with the Department of Health, which is very encouraging. We also might consider the way in which we deliver that care, because it does affect so many people. If it was just one-to-one care, GP to patient all the time, that's going to be very time intensive and costly as well. So why don't we look at digital platforms and involving the multidisciplinary team with all of our allied healthcare professionals to deliver that care. Maybe the practice nurse sits down with the patient first and does some of their weighing and measurements and discussing what the challenges they've had with implementing their dietary change or medications at the outset before they see their GP. So we need to be smarter about the way we deliver that care. Lack of education and guidelines. Andrew, you spoke about this earlier on as well. And I think, yes, we GPs love education and training. We're keen to soak up as much information as we can. So we do need accredited education programs so that GPs can upskill in this area. There's no point in a patient coming to see their GP for help with weight if we don't have the skills and knowledge to deliver that care. So specialist recognition that might even be linked to MBS item numbers in much the same way that happens with mental health care at the moment. So a GP that's done upskilling in mental health has access to higher rebates for doing mental health care plans. The same thing should be happening for obesity as well. Then there's the infrastructure. Setting up a GP clinic, GP-led obesity clinic from scratch is time intensive as well. I did that myself, and there's a whole lot of upskilling of the GPs and training of my GPs, gathering resources for dietary interventions, information about medication and treatment options that we deliver to patients, and lifestyle programs as well, so that we don't repeat the same information time and time again. So the solution may be funding the infrastructure that helps to deliver this care in primary care. We might need to also have certain sessions in general practice that are just for weight management. And that could also be, and I'll come on to this now with time, maybe we need to look at shared medical appointments where we have people who live with obesity supporting one another, accessing care, understanding some of the common themes that are applicable to every patient, but also having that individual one-on-one in front of other patients who live with obesity. So 60% of healthcare professionals stated that lack of time was a barrier to discussing their obesity with patients. So we need to remunerate care for GPs to take the time to discuss this with their patients. And we need to make use of our multidisciplinary team as well to deliver that care, and use technology to deliver lifestyle advice, dietary interventions as well using technology, and those shared medical appointments that I discussed as well.